Now, for the first speaker, we have with us Professor Vikram Datta, sir. Sir is Director Professor at the Department of Neonatology, Lady Hardinge Medical College, Delhi, India. He is the President of the Nationwide Quality of Care Network and the Vice President-elect for 2022 at the National Neonatology Forum. He is also the guest editor for BMJ Open Quality South Asia Edition, a member of the editorial board International Journal for Quality in Healthcare Communications, and an expert at the ISQA. He is a lead National Mentoring Group and Technical Resource Group lead for Sustainable Model for Lakshya, and a member of the Quality Equity Dignity Working Group at the Ministry of Health and Family Welfare, India. Sir, I would request you to speak about restoring joy in work for frontline healthcare workers to manage stress.
Thank you so much, Dr. Ashna. Good afternoon, friends. Am I audible?
Yes, sir, you're audible.
Okay, great. Last workshop, there was some issue with my audio. So before we start on the very important aspect, I think Rahul has done an excellent job in analyzing the preliminary results of the survey which we have conducted across the country. And it has shown a very worrisome finding that nearly 1/3 of all the healthcare workers are facing depression and psychological stress. Well, friends, this is the right time, and I should compliment UNICEF India for supporting this initiative in helping us combat this silent pandemic before it takes its toll on the mental health of the healthcare workers. So I would like to start today's session by making it slightly interactive. We'll have a couple of polls in between my session. And for that, I would thank Dr. Rahul for putting up the polls. So Rahul, can you just start the first background poll which we will have? This is a poll on the Mentimeter, and we'll request all the participants to kindly visit the Mentimeter website. Rahul is going to give you the details and key in your answers and then get back to the session. So Rahul, can you just come on over, please?
I'll quickly do the screen share, and all of us can then start responding it. So I would request all of us to, take out our mobile phones, or we can do it in another window on the laptop also, and go to menti.com. That is www.menti.com, and once you are there, you will see a box in which you have to key in the code 19725574. Once you key in the code, you will see this question that is displayed on the screen. Name any 2 activities that bring joy to you. There would be 2 options. You can respond. You can respond as many number of times as you want. You just key in your answer and hit the submit button. That's it. So I'll wait for 30 seconds before we can start having a look at the answers.
Rahul, you can, I think, put that link, if that link is in the chat box. I think it will be more easy for people to visit that website.
I'll just
with the code. So they can just click on the chat box and they'll be taken to.
I'll put the direct link.
Yeah, I think that would be wonderful. Yeah. The participants are requested to just click on the link which Rahul has posted in the chat box, and you'll be directly taken to the Menti poll. And you can key in your answers and just hit the submit button and come back to the Zoom.
Come back. So we have about 15 participants. I would request all the participants, including the panelists, to key in their responses.
You can, Ruchika, you can just click on the link and post your answers there. Click on the link, you'll directly go to the website. And there you'll have 2 windows to key in your answers.
Okay, we are approaching the 30 mark.
Great.
Yes. I think we are
Request
already
Dr.
1 minute.
Priyanka also to key in her
Yes.
answer.
I hope Dr. Priyanka is already keyed in her
Okay,
answer.
great.
Yes. Okay. So I think we are approaching the 50 mark.
Okay.
I'll unhide the results and we can,
Yeah.
get an understanding. So,
Okay. So just leave it there. Let it continue to come. Great. So you can see this, friends, you can see this beautiful word cloud which is forming. These are the two activities that bring joy to all the healthcare workers, including me, you, all of us.
yes,
And the
bedrock.
central one is spending time with family, music, reading books, gardening, meditation, um, sharing and caring, helping the needy, taking the dog for a walk, okay, reading stories, singing, traveling, watching TV talks and shows, okay, reading nice articles, touring, giving health education, vacations, adventure activities, passionate working, okay, good rest and sleep, helping the needy, feeding street dogs, very good, playing with kids, excellent. Some time alone, yes, analyzing data, picnic, peace, gardening, long drives, cooking. Excellent. So I think we can take a screenshot of this. This is phenomenal. So these are the two activities that bring joy to you. Okay, so I'll request Rahul to just stop his screen share and I'll just get back, if you allow me, to my presentation. I'll try and keep it very interactive. Okay. So I start with the title of the session which the organizers have requested me to talk today. The talk is titled Restoring Joy in the Work of Frontline Healthcare Workers. But I would just like to start, friends, with a disclaimer that it has been, a difficult journey for me to prepare this session. And I've been like toiling for nearly a week to get to understand how I should address this topic from what perspective. So I would start with the disclaimer that I'm not an expert in this subject, but I'm a seeker myself. And this is a beautiful photograph which I've projected here. And I would just like to tell you from where this photograph is taken. It's taken on one of our morning walks in close to Mahatma Gandhi's ashram in Sevagram. And that was when the sun was rising and, it incited an intense joy in all the three people who were along with me in the walk. And I thought I should share this. And this was a field full of lush green crop, the village houses, the sun, and the beauty of the nature. So this was something which still gives me immense joy. But I would just like to mention here that I'm a seeker myself. So friends, what is joy? Well, when I looked at the dictionary definition of joy, we all have experienced joy at multiple points in our time, be it the birth of our first child, be it our marriage, be it getting into medicine or the nursing profession, be it a cricket match which our country has won, or a World Cup, or an Olympic gold medal which our country recently had, or receiving a vaccination for COVID, or somebody getting back home from the hospital after successfully getting over an illness. I think these feelings all initiate tremendous amount of joy in us. But how do you define joy? Well, the dictionary says that joy is an emotion which is evoked by well-being. Well, again, very subjective. Success, again, very relative. And good fortune. Again, what is good fortune for me may not be a good fortune for the person, or by the prospects of possessing what one desires. So this is how the Webster's dictionary defines joy. Well, the photograph on the right very aptly depicts a woman who is experiencing joy, and there is a word cloud, just like the word cloud which we all created right now. There's a word cloud which describes joy. Well, having said that, I'm showing you a complex diagram. Well, this is a diagram from one of the books which I'm just reading. It's called Power versus Force. Well, this is for the first time, this is a book which maps the human consciousness. And as you know, friends, the human consciousness is something which distinguishes us from the other primitive animals and creatures. And it is the consciousness which has led to the evolution of the human race and has given us the highest level in the pyramid of survival. Well, if you look at this scale, the lowest level of these are energy potentials of the consciousness. And this is how the human consciousness evolves. And as you can see, the lowest energy level is 20, and it's all mapped. It's a wonderful book for people who would like to read it. It's slightly difficult to understand, but wonderful book. And if you look at it, these are the attractor field dynamics of the human consciousness. And if you look at the 700 is a state of enlightenment. It's the state in which most of the gurus and enlightened beings are. And joy is at an energy state of 540. Well, what does it mean? And why am I showing you this attractor field dynamic level of consciousness here? Is that joy is a pretty high energy level of consciousness level. So to experience profound joy and bliss with love, acceptance, willingness, etc., you have to overcome and enhance your consciousness energy level to this level before you can experience pure joy and bliss at all points of time. And that is what I think all the gurus mention, that you should be joyful from your internal state rather than for whatever the external situations are. Well, once I've shown you this, I try to look at lots of, pursuit of joy in day-to-day life. Since the last 10 to 15 years, there have been numerous, world famous magazines who've done cover pages on joy, happiness, mindfulness, what makes us happy, the pursuit of happiness, the science of happiness. We all try to understand what makes us joyful and happy. And still, we are nowhere close to achieving joyful state in our lives. And as Rahul just showed you, not only joyful, absence of joyfulness, but the exact opposite, psychological distress and depression is gaining a ground in our society and our healthcare workers. And that is exactly the reason, friends, why we have got together today to address this very important topic. Well, this is a beautiful slide. This is joy. Okay. When you look at it, you can focus on it. It is a beautiful slide. It shows us the intense emotion. Joy cannot be described. It can only be experienced. Well, but to objectively quantify joy as happiness, because once you're joyful, we presume you are happy. So the World Happiness Report, and you could use your mobile phones, the scanner, to scan this and access this full report on the right side. I put the scanning codes. Wherever I put the scanning codes, take you directly to the source of the document. Well, if you look at this World Happiness Report 2020, the country which ranked first in happiness is Finland. The country which ranks second is Denmark. And the country which ranked third is Switzerland. And unfortunately, the country which ranked last is our neighboring country, Afghanistan. And we are all really concerned of what is happening there at this moment. But friends, equally worrisome is the fact that our country, India, ranked 144th. And the system of ranking is explained by certain factors. It is explained by GDP per capita. It is explained by social support, healthy life expectancy, freedom to make life choices, generosity, perceptions about corruption, and it's also giving a 95% confidence interval. The only countries which are below India are Malawi, Yemen, Botswana, Tanzania, Rwanda, Zimbabwe, South Sudan, and Afghanistan. And friends, as all of you know, these are the countries where there is an intense law and order problem. They are torn by strife, civil war conditions, and our country is coming somewhere close to these countries. So this is not only the healthcare workers, but it is a general survey, and it is very worrisome finding. We all need to get together, fix these issues, and try to pull up our country more higher on the happiness index. Well, when I say joy, this is a slide, this is a photograph, which whenever I look at this photograph, it gives me immense joy. And I'm sure Dr. Sushil will remember this photograph. This is a photograph taken from one of our mentoring visits to Shillong. It's a beautiful place. And this was an early morning photograph and the sun was rising and it was reflecting on the lake, the Bada Pani Lake of Shillong for people who've been that side. But at the same time, I'm quoting here Maureen Besognam. She was the ex-president of IHI and the CEO, and currently is the emeritus president. And according to her, you cannot give what you do not have. I quote directly from the IHI. It's if we are joyful, only then can we make the people who are surrounding us joyful. Now let's look at, this seems to be a glum photograph, but my job today is to address about issues of joy in healthcare workers and workplaces. And as you can see from this, put a question mark here. So my job today at the end of this session is to suggest some of the baby steps which we all can take together individually and as a health system to address the problems associated with lack of joy in our healthcare workers and workplaces. Now, if I focus on the global scenario, joy in healthcare workers, well, this is the largest systematic review which appeared in JAMA in 2018, which was conducted on 45 countries. And it looked at the burnout prevalence amongst healthcare workers. And it found that the higher side of the prevalence was 80.5%. Emotional exhaustion and low personal accomplishment ranged between 86 to 87% respectively. And in the American physicians' practice patterns and perspectives, it was reported that nearly 80% of the American physicians had a burnout. It means that only 20% were ones who were not having a burnout. And similar reports are available from the British Medical Association 2019 survey, where 80% of doctors in UK were at a high or very high risk of burnout. Now, I'm not talking about burnout today, but I'm using burnout as a surrogate marker to chart the absence of joy and happiness and contentment in the healthcare delivery systems. Now, if we come to the Indian scenario, let's see if things are different. Well, the prevalence of personal burnout, happily so for us, is less than the global average. It's 44.6%, but the work-related burnout was only 26.9%. Well, this is also surprising. Now, if you look at it, work-related burnout is less than personal burnout. What does it mean? It means that day-to-day domestic chores, personal finances, personal relationships are taking a greater toll on the health workers' mental health and leading to a burnout rather than direct work-related burnout, which is nearly 50% of what was the contribution of the personal burnout. Very important finding. So the time now not to ascribe all burnout to work-related burnout in India. Also think about personal reasons which may be contributing to the depression. And this is for Dr. Rahul and the team. When we are analyzing, I think we should stratify the personal reasons also and try and see if they were contributing to the depression and other things rather than ascribing it to work-related and COVID-related stress. Now, another worrisome finding in the Indian respondents between 21 to 30 years is that they had a high personal and work-related burnout as compared to older population. What does it mean? That the coping mechanisms or the work-related stress of younger respondents are more, And the same holds true for female healthcare workers. The burnout is more, probably because they have to balance so many things. We can all see in our own houses how much balancing has to be done by the lady of the house if she is working, and more so if she is a doctor or a nurse or a healthcare worker. And the doctors are just 1.64 times as likely to have a pandemic related burnout, but the other support staff are nearly 5 times more likely to experience a pandemic related burnout. Means that the frontline staffs, the nurses, the midwives, the frontline workers, the nursing orderlies, the security staff, more predisposed to get a burnout. So what does this tell us? This tells us, as a policy planner or a health administrator, or UNICEF as a development partner or supporting partner, it tells us the focus areas: younger individuals, females, and the frontline health workers. If I have to prioritize the direction of my rehab, as well as identification, counseling, and management sessions and engagement sessions in the Indian scenario. So now that brings me to next poll. Is joy a scarce commodity in healthcare providers? So now I think Rahul will launch a poll and you directly have to do it on the Zoom. So Rahul, can you oblige me by launching the poll, please?
Sure,
so let's hear what all of you have to say. So my question is joy a scarce commodity? So there are 4 questions and I request everybody to please answer this. This is all anonymous. So the first question you can read and answer, then go to the second, third, and fourth. And at the end of this, we will just discuss the poll. I will just read out the first question. Did you experience joy at work when you first started working as a doctor and nurse? For me, like, it would be that when I got my first job as a lecturer or maybe a senior resident or maybe a resident doctor, did I experience joy at work? Just think of that moment. Close your eyes. Just think of that moment. When you joined your duty for the first day, you got the employment, you came to your workplace full of knowledge, full of energy. Did you experience joy? Coming to the second question. As of today, now for me, it's nearly 25 years. For most of you, it would be much lesser. For some of you, it may be longer. Do you still experience joy at your workplace? Okay, so when today you go in the morning to your workplace, do you still experience joy? The same joy which you experienced when you were going there the first day, maybe 20 years back or 10 years back or 5 years back. And question number 3 is, do you look forward to going to work each morning? Of course, not on a Monday, I would say, but just think about a Wednesday or maybe on a Friday when the weekend is approaching. Do you still look forward to going to work each morning? And my fourth question is, if you were financially independent, means if I was like crediting your salary each month in your bank account, I'm not asking you to come for work. Would you still experience the same amount of joy, or would you still be going to work at your current workplace? If you are financially independent, means that you don't require the salary. Your salary is getting credited, or you've invested and you got some windfall gains from your investments. So that's it. So Rahul, I think we'll take it to the first question. We'll take it to the first question. Okay, great. So for the sake of time, Rahul stopping the poll. So the first question, did you experience joy at work?
I'll just quickly share the results.
Yeah. So 71% of the respondents felt joy when they joined working for the first time as a doctor and nurse. Great. So that's very nice. Now majority, 59% still experience joy at the workplace, but quite close, 41% the fizz is gone. They say that they don't experience the same joy which they were experiencing previously. And if I look at question number 3, do you look forward to going to work each morning? Well, 21% say no, 74% say yes, and 6% don't want to answer. Okay, we respect that. But 20%, 1 in 5, do not look forward to going to work each morning. I'm not trying to look at the reasons why you don't want to feel like going to work. If you were financially independent, would you still continue to work at your current workplace? 25% nearly say that they would not like to continue at their current workplace if they were financially independent. Well, Rahul, I think we can stop sharing the polls.
Yes.
Okay, so these are some, contributing inputs from you people, which make us more learned about the whole situation. Definitely, our answers are confidential, but we can share our answers with you confidentially, one-to-one, whenever we meet. And I think we all feel the same way. So this is a great, eye opener for all of us. So let's look at the fact. Let's all acknowledge that not only is joy lacking in most of the nations, but at the same time, joy is having a lot of effects if it lacks at the workplace. And for us, the workplace is the hospital or the frontline emergency rooms or the ICUs. And let's see what happens if joy is lacking at the workplace. Well, if joy is lacking at the workplace, it leads to lower levels of staff engagement. The people would just not engage, they would not volunteer, they would not look at any work with eagerness. And in turn, this is going to lead to a lower patient experience. The patient will come and be waiting outside, and maybe a couple of doctors and nurses are sitting, but there is one person who's on duty and there are two people who are resting. They won't just try and see, okay, come, why other people are waiting, let's go and see them out of turn. So patient experience is going to be poor. As a result, the productivity of the team is going to get lower. There will be increased risk of workplace accidents. The people will just not be mindful of the situations which are around them. And in turn, like Rahul just mentioned, it will lead to lower quality of care and it will compromise the patient safety. So I'm not giving you any data, but these are the gross effects of lack of joy at workplace. Now, once we say lack of joy at workplace, how can we add the magic elixir that is joy at work? Can we add? Can we put it like a sugar in a glass of juice and make it more sweet? Now let's see how we can do it. Well, if we do it, what are the benefits? I'm going to talk about that first, and then we are going to talk about how we could add joy in the work. So if you add joy in the work, you'll have few medical errors leading to better patient experience. You'll have less wastage. And as a result, the employee productivity will improve and you will have a reduced turnover. People will not be leaving your setups and going for greener pastures. People will not be leaving the country and going to higher healthcare systems or, high income countries. And it will lead to a better financial performance. So I would just say that in turn, it will not only benefit the healthcare workers, but also benefit the healthcare system as well as the country as a large. But before you can pour in the joy in the system, there are some prerequisites. We all know about, on the right side, I'm showing you the Maslow's pyramid. And we all know that there are some basic needs which all of us have, which are the basic needs related to the physical needs, the security and the social needs before we can actualize and think about other people. Well, the same place happens here. Same thing happens here. To have joy at your workplace, first you have to ensure that you have physical and psychological safety. You find a meaning and purpose in your work. You have a good team. The team has autonomy. It can take its own choices and decisions. And the team works in an environment which is fair and equitable. Means there is no discrimination and there is openness, transparency. And the last point is very, very important, that you have participative leaders at the workplace. And what I mean by participative leaders is that the leaders listen more, leaders engage, and leaders are the ones who are more compassionate and empathetic to the needs of the healthcare teams. So these are some prerequisites. If your healthcare system is lacking on these prerequisites, just to think that your teams are going to have a higher consciousness level of self-actualization, and I showed you the consciousness energy levels also, and you just presume that you're not providing them this basic foundation, and you feel that they'll all be very joyful and they'll be performing to the best of their abilities, well, it's a dream. It will never happen. So for administrators, for team members, very, very important, focus on these 6 building blocks before you can aim for joy. So that brings me to the leaders. Taking it from the previous slide, the leaders have got a pivotal role in ensuring that joy is present at all points in their healthcare delivery systems. Leaders can do 4 things, and this is taken from the landmark IHI paper. It's a framework for improving joy in work, and you could visit this and read in greater detail. So the leaders, like I just said, should engage with their healthcare workers. And instead of asking, what is the matter with you? Why you're not working well? They should ask them a rephrased question. And this rephrased question is, what matters to you? The second step is they should try with the team to identify barriers to joy in work and the local setting. Create a systems approach to incorporate joy in work in day-to-day work culture. And lastly, use quality improvement science to test change ideas for improving joy in work along with the teams. So there are different ways. I'm not going to go into the detail, but this is just to sensitize you that the role of the leaders' involvement in creating joy at work is pivotal. No health system can have joy inbuilt unless and until the leaders are committed to making the system more joyful. And that's very, very important. So there are certain barriers to joy at work. What you see in these photographs are some pebbles on the left side and a big boulder on the right side. We all know that we could move the pebbles very quickly. These are the low-hanging fruits, but the boulders are more difficult to move, and it will take time, energy, motivation, etc. So let's look at what are the pebbles which can be moved very quickly in our healthcare systems. If you find that your system is unfair and there is inequity at work, try and address these immediately. Leave is granted to one person, not granted to another person. Opportunities for participation into a conference or maybe a star event, granted to one person, not granted to another person. Good workplace or a posting granted to one person, not granted to another person. Try and remove that with the help of the leaders. Can be done quickly. Coming to the boulders, these are the system-based causes like workload. We all know that in India, there's tremendous resource crunch and staffing issues. Well, these are going to take time and they take a toll, and they are the biggest barriers to joy at work. Of course, overworked, tired, burnt out staffs cannot be expected to be joyful. So let's look at what drives joy at work. Well, this is a photograph from a neonatal ward where I work. And you can see here one of the quality improvement national mentors, Sister Bhavna. And you can see the face of the mothers who are participating in this. And she's demonstrating a hand washing, and you can see the face of this mother. Very, very important. You can use checklists like this, which will focus on harmony, impact, and acknowledgement. Where very, very important is that if teams report more joy of work are the teams which are very clear about their role and what is the role of other people. There is no ambiguity. They are having very strong bonds within their team. Their talents are utilized effectively. They feel that their role is critical to the success of the team, and they know that shared success is celebrated, and their colleagues acknowledge their contribution to the team success. So if these are some of the attributes which teams or individuals So this is just a guidance for you people. You could just incorporate these factors. So there's another very important workplace happiness checklist. So you could just quickly run it tomorrow when you go back to your workplace, and you could ask these questions. You could just print it. You could take a screenshot of this. So you could ask your teams, do we enjoy doing the tasks assigned to us, or do you enjoy doing the task assigned to you? This could be first question, and they are answered in simple yes and no. And if you get more yeses than nos, definitely there is a workplace happiness which is there in your teams. The second question is, do we feel right about the people we are working with? Very, very important. This is the second question. The third question is, are we happy with the financial benefits that we get from the job? The fourth question is, do we have the scope for improving our existing skills? And the fifth and the last question is, do we feel respected and acknowledged at work? Well, I think we could take this checklist, and tomorrow when we go back to our workplaces, we could very quickly run a small survey amongst our workers, and we would be very happy to get the results from you people on the WhatsApp groups of NQCN, or maybe you could just email us, and we would be very happy to see if there is a workplace happiness and what percentage of people scored more yeses out of these 5. Well, this is some of the things. Well, I'm not going to tell you about this in greater detail. This is a 9-point framework of improving joy at work, which is given by Institute of Healthcare Improvement. And you can see that there are a lot of factors which drive joy at work. And the most important point which I would just like to mention here is that joy at work cannot be driven by individuals alone. That is the message which I want to just give you here. Joy at work is a collaborative effort of the individual team members, the managers and the core leaders and the senior leaders. And remember, when I was reading this paper in greater detail, it said that the senior leaders are responsible for all 9 components of this framework. The managers are responsible for 5 components, and the individuals are only responsible for nearly 3 of them. So you can see that there is a tremendous responsibility on senior leaders to drive joy into their health systems and into the lives of the healthcare workers at the field level settings. And that is what is the message I would just like to give you. Now, this was a slide which I just made after some introspection. There are certain personal factors also which accentuate joy at work. And I was just thinking, what drives joy in my work and what gives me happiness at work? Well, your personal factors, I would be happy if you could mention in the chat box. What are the personal factors which drive? You've done it in the word cloud, but still if there's something which is remaining, please put it in the chat box and we will just read it after this. So I just wanted to see the first thing which is very important for me. I felt that good health is something which is one of the personal factors which accentuates joy at work. The second most important thing is financial well-being. It's again one of the very important factors which accentuates joy at work. Good social support, hobbies, in fact, drive joy at work and they keep you de-stressed. Creative potential, the nurturing or creation of creative potential, peer group recognition from your friends and colleagues, acknowledgements, development of positive relationships, both personal as well as professional, access to skill enhancing activities, work-life balance, and lastly, presence of empathy. Well, these were some of the things which I felt were the personal factors which were, driving or accentuating joy at work for me. So some people say campus accommodation, CMEs. Well, yeah, very right. So that makes your life more comfortable, easy. CMEs, build up your skills. So I'm very happy that people have responded to this. So just make your own, just take a moment, introspect, and try and see what are the factors which accentuate joy. Well, the most important part out of these, I try to prioritize. Well, as a father, as a husband, as a son, and as a professor in a medical college, or as the president of an organization, work-life balance for me felt was one of the most pivotal factors which accentuated joy at work. So I just tried to look at, the world literature, which are the countries with the best work-life balance. And you will see here that the countries have been ranked by the quality of work-life balance in 2019. And likewise, I just mentioned here, we are yet to see our country here, but these are the top 10 countries which, are ranked by the quality of work-life balance. This slide is in no way an effort to promote immigration to these countries from your side. So these are the indicators based on how they have calculated it on the working hours, the time available for leisure, the personal time, the employment rate of mothers in the 35 OECD countries, along with Russia, Brazil, and South Africa. So this is how they were graded. So you can see that the work-life balance is very, very important, and the countries are being graded according to livability and happiness. I'm sure the index is about the work-life balance. So what I show you on the left side is joy, and what I show you on the top is a measuring tape. Can we measure joy, my friends? You all know from your quality improvement journey that we say that anything which is not measured is not done, and anything which is not measured cannot be improved. So can we measure joy? If yes, how do we measure joy? Is it easy to measure joy, or is it difficult to measure joy? Well, I surveyed the literature, and the things which we looked at which could measure joy were the first parameters, and these could be outcome indicators for your future studies, is employee satisfaction, employee engagement, burnout rates, turnover rates, retention rates of staff in your units, employee well-being, workplace injury rates, and absenteeism. Well, these are some of the parameters which can surrogately measure the joy which is present in your healthcare delivery systems. Friends, having said that, engagement of the healthcare workers is something which is the most important indirect marker of presence or absence of joy in a healthcare system. And there is a modified Gallup 12 engagement survey. You could just scan this barcode, scanner code, and you would be taken to the Gallup website. This is a Gallup 12 engagement score. And if you have more yeses here, again, you could do it tomorrow in your health delivery systems with your teams. If you have more yes, means your team are more engaged, and surrogately you can interpret that your teams are more joyful. Well, this will give you a greater understanding of what is going on in your system, and I'm sure we all will be in for a surprise if we get an honest answer from our teams of this engagement survey. Well, there are some examples, and I would thank Dr. Kedar for sharing some examples with me from Royal Free London NHS. You can see they've done some quality improvement projects where they tried to look at staff well-being survey and also trying to chart, have you had a good day at work today? And a couple of days back, I asked my DM students in the morning to just think, have you had a good day today? The second question I asked them, and I told them you don't have to answer. The second question I asked them, why do you think you are having a good day? And the third question I asked them, would you like to have tomorrow, the day after, and the day after also like today? If yes, what would you do? If no, what would you not do? And I had a smile on most of my students' faces. They said, sir, it feels very good when we are introspecting and trying and seeing whether we are having a good day and what are the things which are driving a good day. So friends, you can see the NHS teams have charted the good day data over months and years, and you can see how their median data is rising, their good day scores are increasing. Well, can we do something like this in India? Well, I'm sure NQCN teams and the other teams which are participating can now think on these lines and try and map their happiness and the joyfulness in their units. Well, that brings me to the last aspects. I'm sure most of you have heard about mindfulness. This is something which I would just like you to scan this code and you will be directly taken to a IHI Open School Course 103, which is a full course on incorporating mindfulness in healthcare settings. What is mindfulness? Well, mindfulness is paying deliberate attention to the present moment. I would just say that. Not worrying about what you're going to eat, whether the workshop is dragging beyond its routine time, whether you have to pick up your child from the tuition in the evening, whether the air conditioner is got to be fixed, whether you got to catch up with your fitness routine, and whether you have to go back to office tomorrow morning. Well, this is not mindfulness. So staying put in the present moment with an attitude of non-judgment, acceptance, and full awareness is mindfulness. And I would strongly recommend everybody to undertake this training course on mindfulness. It has tremendous benefits for the healthcare providers. It will decrease your levels of stress, anxiety, depression, and pain, because it will root your energy into the present moment and pull it from the past and the future. We are mainly catapulted into the future, or we delve into the past without thinking about the present moment. Friends, it is only the present moment into which we can experience our life, experience the joy and the wonderful experiences of this life, not the moment which has passed, not the moment which is about to come. So it is only the present moment. So the mindfulness will increase your sense of control and personal energy, because it will reduce the sense of urgency, will strengthen your job performance, because you will now live life more consciously. And you will recognize that there are certain behaviors which are habitual and which are leading to more stress, depression, and anxiety, and you will try and stay away from them. And it will lead to a greater acceptance of things which are beyond one's control. Very, very important in pandemic times, because we realize that things in the second wave, we've all been through it. Things were beyond our control at a point of time. And these will help us to tackle these emotions in upsetting situations like deaths and taking care of the dying. So there are two apps which I recommend. I'm not a guru, by the way. I would just recommend these two apps because these are the apps which I use. One is a mindfulness bell. It's a beautiful sound. You can just set this bell. You can download this from the App Store or the Google Play Store, whatever iOS or Android phones you're using. At every hour or every 15 minutes, or it depends on how messed up is the situation where you're working, this bell will ring and it will remind you either to take a deep breath, or it will remind you to just stay focused in the present moment. And then, friends, there is another app, which is the Calm app. And this is one of the most voted apps. If you don't have it as yet installed in your telephone, I would request you to do it straight away. So this is no way a promotion for these two apps. I'm sure most of the content is free on these. You could use this and they would help you in being more mindful and being more relaxed. So coming to the last slide. Well, this is a photograph. This is a beautiful photograph. And again, I have posted the link to this photograph. This is from a Swedish photo artist, and she has balanced these stones. I've seen the YouTube video, how she has balanced. And can you see, most of the people will feel that this is a Photoshop photograph. Can you see the stone on the top? The stone on the top, I emulate it with the leadership. The stone in the middle is the middle rung of the healthcare providers. And the stone at the base is the healthcare delivery system, or it's the system. And you see how the whole thing is beautifully balancing despite the misalignments, as well as the center of gravity falling outside, and they are all standing in a pool of moving water. So friends, if objects like stones can balance, can't we balance ourselves and bring some balance, happiness, and mindfulness into our lives? We can use the tools of improvement methodology to identify the factors which are accentuating or reducing the joy and happiness at workplace. So first identify the things which are upsetting us or improving our happiness. Just write, maintain a journal, and try and move away from things which are reducing your joy and happiness, and try to accentuate things which are giving you more joy and happiness. Maintain a journal. Very, very important. Work as a team, and very important, involve your leadership to test small changes at your workplace which will restore the joy and reduce stress at work. Very, very important. Measure and display your improvement journey, like I just showed you the NHS data. If we have data, today the happiness score is this. Next week, the happiness score has gone up. It means it is a positive motivation for our teams. Or if the scores are dipping, honestly, anonymous scores are dipping. As a team, we would know that, yes, we have to fix it. 30% of my healthcare workers coming back depressed is something which is very, very worrisome. And I'm sure this data we are going to be sharing with Government of India as well. And I think we need to fix these things straight away. And who's going to fix it? It's all of us who are going to fix it. And lastly, friends, be vocal. If you are experiencing the lack of joy, if you are experiencing some distress, be vocal, seek help. And we have an excellent team today, which is there to provide help. And very, very important, if you are having an insight and you can provide help, please extend that hand of help and provide help. And today's workshop is an help in this direction, which will provide help. And lastly, for my friends in NQCN, let's make 2021-2022 a joy at work collaborative year to enhance patient safety and quality of care and make our healthcare workers' lives more meaningful, more joyful, and our healthcare more safe. Thank you so much. And sorry for extending it.